What is decolonized trauma-informed practice? That is the type of trauma-informed practice I teach. My name is Emily Gibson. I'm a well-being and trauma-informed practice educator and consultant. I work with all ages, all sectors to help us understand how best to tend to ourselves and to create environments and interactions where people feel safe enough to engage. When I talk about taking a decolonized approach to trauma-informed practice, there are a couple things that I'm specifically weaving in and value. Now, this is not the be-all and end-all. I'm sure that there are more things that I could be doing to better embody a decolonized approach, but these are some of the things that I work with at this moment. So first and foremost, I acknowledge in all of my courses and workshops that Indigenous people and people of color have experienced and continue to experience trauma as a direct result of colonization, as a result of systemic oppression and racism. So we look at Indigenous trauma theory, which talks about the soul wound, which talks about intergenerational trauma, which talks about our blood memory, and which really emphasizes trauma as an experience, not just an event. And if you've ever taken one of my courses, you know that we dive into specifically what those topics are so that we can really understand that in our work. The other way that I aim to take a decolonized approach is we are taking a holistic and whole organization approach to trauma-informed practice. So if I'm working with an organization who wants to be trauma-informed, we acknowledge that every single person in that organization, in that building, needs to have an understanding of what trauma-informed practice is, how they can be trauma-informed in their role, and then do that. So this is not just about, senior leadership participating in this or frontline workers. We're looking at the whole system here. We also dive into and acknowledge our unconscious bias and aim to take an anti-racist approach. So a lot of the time with trauma-informed practice, we will learn that it comes back to us needing to heal our own trauma, us needing to unlearn certain narratives that we have internalized, and to look at our unconscious bias. It involves this vulnerability to acknowledge that we are not perfect and that there's work that we can do to better show up for ourselves and for others. The other way that I approach trauma-informed practice from a decolonized lens is that I acknowledge that context and culture is key. If you've ever taken my Decolonized Trauma-Informed Practice certificate, you know that we spend a huge chunk of time specifically looking at what those principles and practices within the framework I've developed look like in your role, in your community, in your organization. The principles and the practices are general in a sense because we have to make sense of what they mean to us or don't mean to us. This is not a one-size-fits-all model. And we are always aiming to co-create knowledge. I am always aiming to learn from others, to learn from my mistakes, to understand together what this means for us. And that is some of the difference that you see in my model and how I talk about trauma-informed practice is taking that decolonized lens. It is slightly different from maybe other approaches that you've seen, but I truly believe if we are not creating frameworks and approaches that are supportive of all people's experiences, then it's not trauma-informed. Then I don't know how that would be trauma-informed. So if you want to learn a little bit more, check out my Trauma Informed Practice Certificate. There is a healthcare specific one and there is a general one, and I am always available for workshops specifically for your organization. So I would love to reach out.